Good evening and welcome to The Square. Tonight's discussion is going to focus on maternal health with a special focus on pre- and postpartum mothers. This is something we're going to talk about, and we're going to look at a silent killer that affects many people, but in this regard, mothers. Those who are expecting, those in pregnancy, and those in post-pregnancy. This is also known as deep vein thrombosis, also known as blood clot, and we are joined on this show tonight by someone who actually is a survivor of thrombosis and is an activist through her organization called Run the Clot Awareness Network. Her name is Christina Shimwe. Thank you very much for joining the show.
Thank you, Dana.
We're also joined to give us a perspective in terms of the medical field from an OB-GYN, and this is Dr. Kenneth Ruzindana, who is at Kigali University Teaching Hospital as a lecturer, also at the College of Medicine and Health Sciences, University of Rwanda. Dr. Ruzindana, thank you for joining the show.
Thank you for having me. Pleasure being here. Great.
We are also joined, as always, with our resident panelist, Brenna Namata. Always a pleasure to have you here.
Good, Dana.
Afrey Mwamyende. Good to have you here.
Thank you for having me, Dee.
You were not with us last week.
I missed apparently a very good show.
Yes, and I hope that where you were, you really enjoyed yourself.
No telling, but I had fun.
I know.
You did. You've replaced your glasses.
I needed to see you guys better.
Well, thank you very much all for joining in, and thank you very much for tuning in. My name is Dana Pisi. I am the host of The Square. Now, before we just kick off on this very important topic that affects people and is often very silent, I would like us to just have a midweek recap. If there's something you'd like to share, highlights of the week so far, if there's any.
So this is to kind of go back to a conversation we had around during the show around Miss Rwanda. And to avoid sounding like a broken record, I'll just keep it short. I remember I asked a question very specifically around language. And I was reassured that the contestants have the freedom to answer in whatever language they choose, but we saw something that was quite contrary to that, or at least it showed gaps in that aspect. So I think it was very interesting to know that, or to see that it manifests things that are considered small, or at least it highlights something about the show in itself. So yeah.
Interesting. Brenna, anything?
Mine is one. Looking forward to the reforms that were announced by Cabinet in the education sector. I think they're timely. Two, there was a piece about, I think it was Business Insider, which quoted the head of the IMF cautioning African governments or the developing world the issue of consultants. Because most of our governments...
international consultants?
Yes, international consultants, the likes of McKinsey, Boston. The bill is always, most of the time, not worth it. Because typically what consultants do is create more work. You know, so in the end you find that our governments are losing even the little. Yeah. So it was interesting to see that come from the head of the IMF. Yeah.
That has a big group of consultants in the institutions as well.
Yeah.
My highlight, I think, was the Rwanda's move to ban single-use plastics. I found that very interesting, but I'm really curious to see the replacement and how also biodegradable these replacements are. We've had banning of plastics before, and there are just some things that, unfortunately, that are replaced and are not conducive to whatever it is that they're packaging.
I think it's,
so I'm interested to see, I think it's a great idea, but I'm interested to see how this turns out and how the single-use plastics are going to be replaced by obviously environmentally friendly products.
I think the risk is always the institutional coordination that we always talk about.
Yeah.
Like how well thought out is the implementation.
But even the private sector, I mean, we have a section of our private sector that is concerned about the ban, because when you look at the region, again, because we've failed as a region to agree on what our priorities are and what we need to do, you find that some members of the Rwandan private sector their cost of production goes up because we are insisting on these standards, and when their products go across the region, they cannot compete because the cost of packaging is quite high.
So I think that's going to be an interesting conversation that we might worth be having on the square.
Definitely, why not?
Yeah. So we're here talking about maternal health with a focus on DVT, deep vein thrombosis. blood clot, as you know. This is a silent killer that affects people. And in this conversation tonight, we're going to look at mothers. And I'm very happy to have both of you here. And my first question is to you, Dr. Kenneth. And I'd just like to start this conversation generally by understanding, what is DVT? How does it manifest? And how can people, what are preventive measures for this disease?
So DVT is a subset of a group of illnesses that we call venous thromboembolism. DVT is deep venous thrombosis. So venous thromboembolism is a group of, let me call them a group of illnesses whereby blood is supposed to clot, but if it clots inappropriately or clots in areas where it's not supposed to clot, then it forms what we call a thrombus. A thrombus is a collection of what we call fibrin tissue and platelet count and platelets, and which causes, so when they form, when the blood clots, they form this thrombus. So a thrombus will block blood circulation when it blocks a blood vessel. So when the blood vessel is blocked, it means that the blood supply to a particular organ is cut off. So in this case, when we talk about deep venous thrombosis, in this case, the thrombus forms in the lower limbs. In women, it forms mainly in the left leg, and so the other subset of venous thromboembolism is pulmonary embolism. So when a thrombus breaks, when a small thrombus breaks off from a clot that has formed, for example, in the lower limbs, and flows to the lungs.
Travels up. Yes,
it travels up. Let's call it traveling up to the lungs. Yes. It blocks off a series of vessels in the lungs, and that causes what we call pulmonary embolism. So this is let's call it a group, and DVT is just a subset of this group. So and clots can form anywhere. They could form in the lower limbs, in the legs. They could form in the brain, in the arteries of the brain. And we have what we call strokes. You've heard about strokes. Or it can form in the coronary arteries of the heart. And you have heard about heart attacks or coronary heart diseases. It could form in the, in the mesentery, in the intestines. You could have a clot in the mesentery. So it could form also in the kidneys. So it can form anywhere. So DVT, which we are particularly talking about, occurs when the clot forms in one of the superficial. It could be superficial or the deep veins of the legs. So I must mention that this illness does not affect only women.
Of course.
It does not affect
only women. Focusing on maternal health.
So given that we are talking about maternal health, we shall talk about it in women, and this is where my expertise comes in as well. So in Rwanda we do not have statistics for the prevalence of this illness in the whole country, but we have data coming in from the health management information systems, where all countrywide data is gathered. And venous thromboembolism, so when I talk about VTE, I'll be talking about PE and DVT.
PE we got is pulmonary
embolism.
Yes. Serious one.
Yes.
I guess they're all serious.
They are all equally serious.
Yes.
So let me use VTE. Is responsible for about almost 20% of maternal death, indirect maternal death. So we have direct maternal death and indirect maternal death. So when you talk about direct maternal death, so if an illness is exacerbated by being pregnant, and it causes a mother to die within the period that we call the maternity period, which is during pregnancy, during childbirth, or up to at least 6 weeks after delivery, which you call the postpartum. So this illness is responsible for almost 20% of indirect maternal death. So it's a serious...
For women across the country?
Yes, for if we take data from our HMIS.
Yes.
And so it's a serious illness, and as I mentioned, it affects every, it could be for men and women, but specifically women at increased risk. And why are they at increased risk? Pregnancy alone is a risk factor for this illness. Being pregnant raises, let me call it your risk of getting the illness by over 10%, by over tenfold.
Oh wow!
And why is that? So pregnancy is what we call a hypercoagulable state. So in anticipation for childbirth, your body makes coagulation factors, which are in one way preparing your body for childbirth, because childbirth involves a lot of bleeding and blood, so your blood has to clot. So when your body prepares for that, and it increases the number of both the number and the quantity of coagulation factors, and as a result your blood can easily coagulate. Okay. The other thing is that a pregnant uterus, what we call a gravid uterus, also increases both pressure, mechanical pressure, and so it impedes, good circulation, especially from the blood flowing from the lower limbs and back into the heart and throughout the normal circulation. So both the hypercoagulable state and the gravid uterus significantly increase the risk of a pregnant mother of having venous thromboembolism, or in this case DVT. Yes.
Okay. That's I mean, I think it's a blessing to be pregnant. It's a blessing to give life.
Yes.
When you say that being pregnant actually increases the risk for this disease, it's very sobering.
Yeah, it's you usually say that pregnancy is a good illness.
Yes.
Because you're expecting a baby, so it's a great illness. But at the same time, it's a period of time in a woman's health which has a lot of risks, I must say. That's why you need to come to a doctor when you get pregnant.
Absolutely. I'd like to just, of course, now hear from you,
Okay.
Christine. You've been an activist since 2015, spreading awareness of blood clots through your organization, Run the Clot Awareness Network. Last year, you won an award from the International Society on Thrombosis and Homeostasis on World Thrombosis Day. I think this was October 13th last year. So I'd just like you to share your experience with us as someone who was diagnosed with this illness, who survived it, and also your work to date.
Thank you. I remember it very well, like it was yesterday, because I had just given birth to my third daughter, my third born, and my first two pregnancies were really, really, easy. And after delivering my third daughter, I went home. First, I had her prematurely, so she stayed in the hospital, and I went home. And a week after delivery, I started coughing. Just out of the blue, I started coughing, and this cough was the unusual cough. It didn't want anything to do with medication. I remember I bought cough syrup over the counter, two bottles, and I took them, and the cough didn't go. So after 3 days, I started becoming breathless. I couldn't go up the stairs. I couldn't, stand up and breathe easily. And I remember on the 30th of November 2015, around 3 a.m., I called my doctor. but he didn't pick. It was 3 a.m. And my auntie who was in the house was like, no, that's okay, you know, you've just given birth with cesarean section, surgeries like that, you're going to be fine. And I remember telling her, no, I'm actually dying. And I told her, this is how people die. So you're going to watch me die if you don't do anything. And of course, she didn't know how to drive. And then I remember speaking to my husband, who is also a physician, and he told me, please go to the doctor.
And your husband was abroad at this
Yes.
time?
Yes, he wasn't in the house, and he insisted on me going to the doctor, but I waited for morning. So 2 hours later, I wasn't able to stand by myself. I wasn't able to, you know, the leg was swollen, which is a sign of DVT, but I didn't know. And remember, this was my 3rd pregnancy, so I was expected to be knowing everything to do with pregnancy and childbirth. You're expected to know. You're a veteran mom, and everyone expects you to be knowing. And then around 5 a.m., I said, I'm not going to die like a villager in the house with the house full of people, but no one to help me, because I was dying, literally. I couldn't breathe anymore. So I drove to the hospital. Luckily enough, I live near King Faisal, so I drove to the emergency and left the car at the entrance of the emergency. And the first thing the doctor told me was they have to do an X-ray to check my lungs, because the cough was very, very bad. And at the time, I remember him calling the specialist and telling him he suspects that I have pulmonary embolism.
This is the serious one, like,
yes.
Like
the
basically
lung,
a clot in the lung.
In the lung.
Yes.
So the clot had actually originated from my right leg.
Wow.
And migrated to my 2 lungs, my both lungs, and they were multiple clots.
Wow. In the space of what?
3 days.
3 days.
4 days, because I left the hospital and I started coughing, and I took the syrup and the cough wasn't going, and I sensed that something was very, very wrong, and I listened to my body all the time. Something was coming up. Shortness of breath, chest pain, very intense chest pain, like sharp chest pain, cough. And of course, you know, wheezing. You can't sleep. You have to be in a position where you can't bend, you can't take a side. So everything is really, really painful. And of course, I thought the leg is swollen because I was pregnant. Like everyone thinks that a pregnant woman, it's okay to have, you know, your legs that are swollen.
Yes.
So, and then when they said pulmonary embolism, of course, being a .com, I got my phone and I went to Google.
Yes.
And I started reading, and then I immediately realized I had the condition. But the doctors were still not, you know, in agreement with each other. They said, no, she doesn't look like someone who has this condition. You know, a person who has this presents like this. They were still in that kind of dilemma. And I was there waiting for the next, you know, I'm dying or I'm going to be, I don't know. But I was really looking, because 1 in 4 people, it's written, 1 in 4 people who have this dies. So that's how serious it was. And they said, you have to be admitted. My baby was still in hospital. And I had to spend almost a month in hospital, being treated for this, for blood clots that I didn't know a thing about, you know, a few months back, and I was this person who always, you know, had a doctor's visit. I had consulted all the top obstetricians in the country. I had all the information. I could read. I could, you know, go on Mom's Net, you know, Baby Center, all these. Internet, social media, and all that. I had all the information, but nothing sufficed on talking about this. And after having this first episode, I was put on treatment, which treatment normally goes for if you have clots in the lungs, 1 year. I was supposed to be on 1 year treatment, on blood thinners, and after 6 months, I clotted again. So, and in between, because there was nothing in Rwanda, no support group, no one to talk to about this, and then, you know, this is something that takes lives like this. And then I had heard about women who had died while I was in hospital. You know, people talk. They come in and say, oh, you're sick of this, and so just died. And you're like, this could have been me.
Yes.
So, and that's how I got the idea of, you know, starting the Rwanda Clot Awareness Network,
Yes.
which actually started as a small umbrella with people who had the same problem as myself. And we started from, you know, very small, a tea party at my house, and then the group expanded. So this shows you how this is actually a problem. And then I got the second clot, and then the third clot, and as we speak, I've had 5 episodes of blood clots.
Since 2015?
Yes.
To date?
2015 to December 2018, just last month. And it happens that sometimes I know the symptoms, I can listen to my body, but sometimes you clot in the brain, and you thought about these symptoms, which were chest pain, you know, leg pain and swelling, and this time now you have a migraine and you have blurred vision, and you can't be in a room that is lighted up like this. You have to be in a dark room. So
that's a symptom of clotting in the brain?
The clotting in the brain, yeah. That actually most of the time leads to stroke. Yeah, because I think over 90% of the strokes are actually clot related. So I actually had this, and it just came, you know, out of the blue. I started having a migraine and blood vision, and then when they did the MRI, they found a clot in the brain. Yeah, so this has been my journey since 2015 to date in what we're talking about today. But it all started with lack of knowledge about the condition and the fact that it's not common in Rwanda and in Africa in general. But I would like to highlight that much as this condition is not common, it's actually not very different from other countries. Be it in America, be it in Europe, women still die in the parking lots because of this condition. So it's actually better to do a timely intervention. So had I stayed home and said, let's go around 10 a.m. when everyone has had their breakfast and everyone has freshened up, I would not be here today. So it's actually, as soon as you know about someone, you intervene. We've lost from that time to, like, for the past almost 4 years that I've been doing this, I've known cases and cases and cases of people who die from their homes, educated and uneducated, equal. They die from their homes because of cultural beliefs. They've bewitched her. She just gave birth. Oh, your mother-in-law just did this, and then the person dies. And if you look at the symptoms the person had, they were clots. Yeah. So and then of course I also have the other side of the other side of the coin that I call a blessing for me, because having had blood clots myself, I am able to tell when someone has blood clots. So with that, I've been able to help 2 people who have been, you know, who are struggling and were in private clinics, and I just, you know, pulled them out of the clinic and took them to the big hospital that could have that could do a CT scan or X-ray or these other tests. So these people are now alive. Maybe if I had not intervened, or if I had not had the condition myself, they would not be able to get the timely treatment that they got. So I went through this, yes, but I also have some kind of blessing in disguise through this. Yeah.
Interesting. Brenna, Ephraim, would you guys like to weigh in?
I think for me, always as a single guy with no children,
Ephraim, you're
the
not
way, am I married? I'm coming for the contribution. Anyway, I think the concern is always what, as a potential father and as a potential husband, what can I do to empower myself so that I can spot it if I'm ever faced with such a challenge?
Yeah.
Can I react to that?
Yeah.
Ephraim, I like that you said that because if you look at maternal health, the burden is usually on the women, you know. And
with,
so it's,
little support from spouses.
yes, and they've tried to get men to come with their wives to hospitals, especially when they're pregnant. I think it's a sort of, is it by law?
It's
Or it's just encouraged?
It's encouraged. It's acceptable,
Yes.
and it has been scientifically proven that accompanying your spouse into the labor room actually does a lot to reduce our pain, to quicken labor. So it's a good thing.
So
thing.
the issue with that, is that because it's a practice that is encouraged. In some of the hospitals, what usually happens is if a woman shows up with no husband or partner, it becomes an issue. They don't actually get the care that they should get. And some actually stay away because they feel they're going to be asked, where is this husband? You must go and get them. So, you know.
To answer a friend's question, be present.
No, but beyond even just being present, I'm genuinely asking.
Yeah.
If I am faced with such a situation, or at least what can I do now?
Yeah.
You know?
Yeah. Christine is presented what we call textbook symptoms of the illness. Sorry to use the word textbook symptoms, but
she's an expert.
So yeah, I know she's such a big expert in the when it comes to thrombosis. But unfortunately, the illness sometimes is masked by other, other pregnancy-related, symptoms. For example, she talked about, lower limb swelling. It's usually either one of the limbs that is swelling. Pregnant women, physiologically sometimes have lower limb swelling, or cramps. These are things that pregnant women, occasionally have. So they could be masked. They could mask, the real illness. And the other thing is that, as I mentioned, pregnancy is a risk factor itself. But there are also other risk factors for the illness. I'm not sure if I talked about this, but things like being overweight, obesity, a big mass, being overweight. Sometimes it could be the first sign for a cancer, for a malignancy, for either stomach cancer or a cancer anywhere in the body. It could be the first sign to show that you have a cancer. I'm not saying that everyone who shows up with a DVT has a cancer, but it could be one of the first symptoms. Things like smoking, diabetes. For women, we're talking about women. They're also at increased risk when they use combined oral contraceptives. Contraceptives. I don't want to discourage women from using contraceptives. They should use them, but it is important that before you start using them, you have to come to a hospital. You are screened to see if you don't have any risk factors, and to make sure that you get the correct contraceptions to use. So all these are risk factors. So unfortunately, the illness may be manifested, just like any other illness. Christine was talking about a cold, a cough, but when it comes to a PE, a pulmonary embolism, sometimes they have a dry cough, sometimes they, as a worst case scenario, they could have shortness of breath, they are grasping for air. So I don't want to blame you, Ephraim. I mean, the illness could be like any other illness. So even for doctors, unfortunately, we could miss the diagnosis if you don't have a high index of suspicion.
So I want before we go to the next question, which is actually to do with misdiagnosis of this silent killer, so to speak. Brenna, you had something quick.
Yeah, no, just to ask Christine,
yes.
Since she's been a patient,
yeah.
if you could give us a sense of our health system, the capacity to deal with, you know, what's the readiness?
Actually, before I come back to you, I wanted to tell you something. You've said something about, you know, being able to auto-diagnose your wife or being able to tell when someone has this. I as someone who is raising awareness and who is doing advocacy, I would actually encourage you to, you know, start now. Don't wait for the wife to come. So your auntie, your sister, your cousin, you should just encourage them to listen to their bodies, because our bodies tell us. If something is wrong, the body tells you. If you don't feel the way you were last night and you're walking out of the house and you feel something is wrong, you have to, generally it's very, very important to just listen to your body, because you know your body, and if something changes, you know what to do. Yeah, and then coming back to what Bana has asked, I would like to say that it's actually what I mentioned earlier, that it's the same. It's the same everywhere. Of course, I'm not going to say that the health system in our country is the same as the health system in another country, you know, developed country. But looking at what Rwanda has in place, we are ready to be, all these times, I've always been treated
Christine,
in Rwanda.
you're being a politician.
I'm actually being frank with you.
Let's go back to when you went to the hospital.
Yes, we're coming to that. We are coming to the misdiagnosis.
Yeah, we're coming to that, yes.
But to tell you, to be frank, I'm telling you that the infrastructure is there. You know, in health, we talk about the 4 S's. The staff, infrastructure, staff, the people, space, and something else.
Service? No, that's
something else. Yeah, I've forgotten. I think I think my colleagues from the global health will just, you know, something I've forgotten. The 4th one.
Yes.
Yeah, and if you have all these 4, you're capable of taking care of anything. Unfortunately, we have this mindset that if I have this condition that is not common, I have to go where it's common. But before you're allowed to go where it's common, you start from what you have in place. To be able to diagnose, for example, DVT, deep vein thrombosis, it's diagnosed with ultrasound. No, ultrasound.
Oh, okay.
Doppler. And this is, I think, maybe Ken will Dr. Ken will correct me, but most of the hospitals have this.
Yes.
But the problem is at the point where someone even figures out that they need to do this. So it's not that we don't have the infrastructure in place, but these are conditions that even when they are being studied in medicine, they are told that they are not common.
So lack of awareness is a factor.
Whether it's in the local communities, whether it's in the healthcare professionals.
Yes.
We have a nurse who recently died of this condition.
Christine, let's go back to the basics.
But first,
he mentioned risk factors. Yes. And if you go to the records, Rwanda is doing well in terms of maternal health, you know, antenatal visits. And I'm looking at you, well-educated, well-traveled, I mean, top, yeah? And throughout your antenatal care, nobody talked about the risks. To the extent that you get home at some point and then you don't know what to do and then you have to go back to... So what were you doing during antenatal care?
But can I just steer the conversation, because I think we're all kind of saying the same thing, and you know, this lack of awareness, both from the patient's point perspective, also from the medical community, which is what I want us to touch on. Misdiagnosis. You're both. What we are learning from both of you is that it is a silent killer. It is hard to diagnose, it's hard to spot from the person suffering, but also from the people in the medical field, doctors. So my question is, as was the case with you in 2015, when the doctor actually told you, no, this is not what you're suffering from, and you actually were. What's being done, and I'd like to hear from both of you, in terms of addressing this issue of misdiagnosing this killer disease?
So,
at least in the Rwandan medical fraternity. So
I want to put this very clearly.
Yes.
That Christine's case is an outlier, honestly. She said she has had, I think, five episodes of,
yes.
you know. So she's an outlier.
In what sense? In what sense?
You know, I did mention that there are also some individuals who are genetically predisposed to having blood clots. We call those inherited thrombophilias. I must admit that unfortunately in our country we don't routinely screen for those because honestly they are expensive tests. They are available in the country, but they are expensive tests. So,
but do we know? Do we know? And I'd want to ask people who suffer from DVT and everything else related to thrombosis. Are they of the? Is it genetically driven? Is it a hereditary issue, or is it something around these risk factors?
So yes, it could be both. It could be acquired if you have either one or more of these risk factors that we are talking about. Or it could be genetic, because you don't know that you are genetically predisposed to having a blood clot until you do some tests. So we request for some of those tests when unfortunately you've already had a clot, which in this case I'm not sure about Christine, but she probably must have had the tests. So our healthcare system honestly is very well equipped to handle these cases. I must insist that as a good clinician, you need to have a very high index of suspicion to be able to diagnose the illness, because it may manifest just like any other illness. So doctors are not demigods. They could misdiagnose.
But is the prevalence of misdiagnosis in our medical community, is it high? With this disease?
Well, I'm not in position to speak for the medical fraternity, but I will speak for at least for myself and for the hospital where I work. Is that we know that we see these illnesses quite often. I told you it is responsible for almost 20% of indirect maternal death.
Yes.
So it's quite common. And you mentioned something about antenatal care. Unfortunately, I don't know if it's because of patient numbers and all these things. Talking about venous thromboembolism is in a routine antenatal care is not a common thing to do. I'll admit to that. But this illness, first of all, you don't have to have risk factors to get the illness. You don't have to have the risk factors. I talked about, being overweight, being obese. But it can also happen to women who are not obese. So maybe with the Rwanda Clot Awareness Network, I think this is an illness that probably we need to, routinely talk about in our antenatal care. Otherwise, our healthcare system is very well placed to manage the illness. The medication is available, albeit expensive, but it is available even with our healthcare insurance, and the diagnostic equipment is available. And I'd
like to. Are you in agreement with him?
Yeah, partly yes.
As someone who actually,
partly yes,
is
because
in the hands of these caretakers.
We actually I personally recently conducted research on pregnant women who were attending the 3 referral hospitals in Kigali: King Faisal Hospital, Rwanda Military Hospital, and CHUK. And the results were like only 9.3% of the 150 participants knew something about it, had ever heard about it. And actually a bigger percentage of the 9% were like, oh, we heard about it when you started talking about it on TV. We heard about it when you did the World Thrombosis Day and the Blood Clot Awareness Month. So we've just started learning about it. And of course, looking at the doctor-patient ratio, and this is a very important thing to highlight. It's very hard for a doctor to spend more than 10 minutes talking to this patient about a condition that is not common. It's not common, but it's a silent killer. And now what we do at the level of the network is it's very expensive. We are still working around it on how to find time for doctors, but it's more affordable to sensitize the patients, the women who are pregnant, than now going around and sensitizing the doctors. Because if I have more than 2 risk factors, for example, in my case, I like to use my case because I'm a textbook patient. And I had, no one had ever told me about this, but I had a high BMI. I had,
body mass index.
Yes, and I had a cesarean section, and I was pregnant, and I was a frequent flyer. That's also a high risk, that's a risk factor.
This was a group of factors just waiting for you.
Yes, waiting for anyone, but me now, I was, you know, because I had a job that required me to travel. And it's called, this condition is called economy class syndrome. So of course, that tells you the class I was flying. I had that, and then I had, you know, I was not hydrating throughout the day. And then I had hormonal imbalance. That's also another issue that we need to talk about, and preeclampsia. And preeclampsia is also a risk factor, which preeclampsia actually caused the premature delivery. So in that sense, if someone had, you know, read between the lines, they would have found out the problem before.
I wouldn't call it reading between the lines. I think if someone had done their homework, to be honest.
But
what she's describing what she's describing.
But not all.
If she comes to you as a doctor,
Yeah.
if she comes to you as a doctor, you're spending time with her. What questions are you asking if you cannot understand her history?
Be asking about her lifestyle,
Routine.
diet. I mean, and by the time she's already telling us lay people who are doctors about all these conditions, all these factors leading up to it.
But I learned about this the other day. I didn't know anything. I started reading about this condition as soon as I had it. So in 2014 or in 2012, when I had my second born, I didn't know all these things. I recently learned that there is a link between preeclampsia and blood clots, thrombosis, and then also a link between, you know, estrogen hormone, which is a hormone that women have, with clotting. So these are things I'm learning from my experience, and these are things I'm using to change the situation at hand right now.
For you and other people.
Yes.
Can I just weigh in? I just like to go back to Berna, because Berna has a point. I know she's repeating on this show tonight, and it also goes back to our topic on service delivery that we had here last week, rights of patients, whereby, you know, the interaction between, and this goes back to service delivery to a certain degree, between the patient and the doctor. And this is what you keep on bringing up. Why, and I want us to go back to this mixed diagnosis. Is there an element why the reason this is, as Bernard pointed out, the time between patient and doctor is not enough to ask all these important, valid questions? But Bernard, do you want to weigh on that?
Yeah.
Is that what you've been pushing?
Precisely, because if you've spent time with the patient, she explains her story, you would immediately highlight and say, okay, you are at risk. By the time she's discharged, at least let her be aware that she's at risk.
I know the doctors are on the spot now, but I need to add that when we're doing antenatal care, there are lots of other illnesses that we screen for. It's not that when a patient comes in, you spend 1 minute with them. There are lots of other things that you do.
But can I tell you,
but
the
the other thing is
few
that
times that I've been ill in our local doctors. I remember this happened to me. I think the last time I was ill to go to a doctor was long time ago. But I had to actually force the doctor to look into my eyes and look at my tongue, and I said, "Look, I have jaundice," and the doctor's like, "Eh, Zico, you know, you actually have a point." And that because it's what I was doing, what Christine was doing. I Googled, I had yellow eyes, I had, you know, and I came to the doctor and I had to force the doctor to just pay attention to me. This is a long time ago. I'm just hoping this has changed too.
So I should say that we are talking about thrombosis, you know, but there are like hundreds of other illnesses that affect women.
But at 20, you mentioned a statistic, and I'm sorry to interrupt. I've heard people say that it's rare, but if it's the cause of 20% of
Indirect
maternal death. I'm like, this is really.
We are waiting
like
for
a
it
big
to
problem.
become.
Yes,
pandemic.
it is. I agree with you. This is a big problem, and I think it all comes down. I need to continue insisting that we need to raise our index of suspicion as clinicians while seeing these patients, and then even though Christine had all these risk factors, as we call them. Not all women who have these risk factors will have a thromboembolic event as she did. So it is important that we know how to diagnose the disease. As a good doctor, you need to raise your suspicion index and you to be able even to screen for it. So for now, I think that the best that we can do is to bring back or to bring on board thromboembolism, as part of routine antenatal screening.
I'd like us to just go to our Twitter feed and look at some of the tweets that we are getting from people on this topic. This is a tweet that is from Steve Rwakojo, who says, and he's addressing you, Dr. Kenneth, you're encouraging us to do clot test exams, and my question is, what's the cost of blood clot medical exam, since some specific medical exams are not insured and are expensive?
Yeah, I didn't tell everyone to go and do these tests. Yes. These tests are only done for people we suspect
so you
are genetically. Are genetically predisposed to forming
so
clots.
You can't just
for example,
and go and test yourself.
No. I don't think it. You even in the best healthcare settings, they don't do routine thrombophilia workups.
Okay.
So we do this kind of tests only that for a specific group of patients. For example, we suspect have genetic predisposition or have had, for example, multiple clots like Christine did.
Yes.
So,
but very quickly, what cost? Can you give an average in terms of cost of this?
They are
tests?
expensive tests, honestly. I know from some of the private laboratories in Kigali, they cost in the region of about 250,000. So
wow.
Beyond.
Yeah, or even beyond.
Above 250,000.
Yes, so they're expensive. But these are, thrombophilia.
Yes.
Workup tests.
Yes.
They are not things like ultrasound, which is routinely done in all our hospitals.
But they're expensive nonetheless.
Yeah, they're expensive,
our next tweet is from Ivan Rukundo, and Ivan Rukundo has a question for you, Christine. He says, thank you, The Square, for choosing thrombosis in prenatal and postpartum mothers as a talk today. My question goes to Tina. Beyond activities of educating DVT, PE victims, what's the association doing to raise awareness in non-victims? How do you work with the medical fraternity?
Oh, that's a very good question. We are actually not educating only victims or members of the association, of the network, We are going out to the public, the ones who have experienced the condition and those who haven't. We are actually more focusing on those who haven't, because a big percentage of those who have actually gone to the level of having recurrent clots. Many of the members of the network actually have had recurrent clots because they have more than one risk factor, and if one risk factor is eliminated, then another one comes. So what we are doing at the level of the network, we have projects in the house, like on our tables we are planning to do many things, but we also set short-term goals and long-term goals, and one of them is that is very, cost effective, because we are a network that is, still growing. As I said, we started as a small group in a compound. Dr. Kenneth was there, and most of our medical doctors were invited, because the idea that I had at the time was to invite my friends, and my friends would invite their friends, and we would make a big group. I think on that day we had over 60 people. And the doctors who were in attendance explained to the participants everything about this condition. So it included those who were already taking treatment, who had suffered from thrombosis, and those who hadn't. Now, what we are doing today that comes to my mind concerning the non-victims, we are going to the people that we think or have many risk factors if they're not careful. For example, we have a program that goes to corporates that have over 20 employees. So if a company has over 20 employees, and this is a company, let's say a bank, we expect these employees to sit for long hours.
Very sedentary lifestyles.
Very, very sedentary lifestyles,
Yes.
and then we know they're not going to get time being, executives and all that to come to the public awareness, the awareness campaigns that we usually organize. So we find them there. We've done it since September last year, and it's doing very well. We've already visited different companies, and we do this with doctors. We invite a member from the network joins a doctor, and then the member shares her experience, especially if they were sitting in office for long hours, and then the people will relate, and then the medical doctor answers any questions they have. And these questions keep coming. We have our website, we have emails that the HR department keeps sending their questions.
So from 2015, sorry to interrupt because we're running a bit of time, since you started, what's the impact, if you can say in terms of numbers? People, lives being saved, or?
I don't have the exact figures on the tips of my fingers, but I would say that we've saved over 6 lives now, and these are members.
Wow.
Some of them had gone to the level of having recurrent clots. We have a young gentleman who is less than 30. He gave his testimony during the World Thrombosis Day. He had been having recurrent clots, and he's young, and he's not a mother. He has not given birth. We found him in Rwanda Military Hospital, and we approached one of the pharmacies in the city, Vine Pharmacy. I actually would like to mention them because they're helping us a lot. They give him this very expensive treatment on a monthly basis, free of charge.
That's
and this gentleman is now okay.
Yes.
He got treatment. He has his health has deteriorated because of this condition. He ended up having cardiac issues and then having
basically, but technically in 3 years you saved 6 lives.
6 lives, and of course
that's substantial.
Yeah, 6 lives. But I would also mention that the impact, the very big impact we've done is on education and awareness. The people that have, the people that can call our number and tell us we have. Let's say no, not Bushenge. There is a hospital that is after Nyungwe.
Yes.
Chibogora Hospital.
Yes.
Chibogora Hospital. Yeah, I think. I don't remember the hospitals, but I get these phone calls from different parts of the country, and people tell us, oh, here we have 6 cases, here we have this number of people that don't have the means of getting a CT scan done, who cannot come to Kigali. So the problem is there.
Yes.
And we have a cocktail of solutions. So it's just a matter of time that we streamline all these solutions to go to the people that need them.
Thank you, and keep up with the great work. We've come to the end of the show. I would like us to just give closing remarks. Brenna, Ephraim, I'll start with you. One-liners, if you can.
I would say I'm aware.
Yes.
Now I'm aware.
I've
learned quite a lot. I think moving forward, even beyond talking about maternal health, I as an individual will look for the financial resources and go get myself tested.
when you're symptomatic.
No, I'm not. I say this because when you haven't gone to the. I'm a bit cynical. When you haven't gone to the doctor for a while, you ask yourself, you're like, okay, they've checked everything and everything seems fine. Maybe there's something else I can check for. So it's one. I lose nothing other than the money.
Brenna, very quickly, closing remarks.
We need to empower women, especially rural women, because they don't have the opportunities that urban educated women have. So I think the interventions have to be right at the heart of rural women.
Thank you, Brenna. Closing remarks, Dr. Kenneth. Very briefly.
Just like any other illness, when you don't feel well, it's important to go to a doctor. I need to mention as well that non-communicable diseases are real, and they're taking lots of life. So, as a good citizen, keep healthy, exercise, control your diet, and where necessary, cut down your weight.
Absolutely. Christine, very brief closing remarks.
Mine will be to thank you
Yes.
for having us here and for giving us this platform to be able to spread the gospel, and then to encourage our viewers that you should listen to your bodies. If something is wrong, you know it, just look for attention.
Thank you very much. We've come to the end of the show. Thank you for joining us. Please keep the conversation going using the hashtag #TheSquareRW. We have come to the end of the show, but this is something I think that in maternal health in general, I think is something that we'll revisit on The Square very soon. I'd like to thank our partners, Uzi Collections and Bourbon Coffee, always made in Rwanda. Thank you for watching and have a good evening.